Good evening, folks. Welcome back to the Safe Edge Show. After a few weeks hiatus, we're back and we've got lots to catch up on, lots to discuss. Joining me this evening are Sarah from Safe Ed for All and Nikki from The Hive. Welcome back to you both. I'm also joined just about by my Socialist Telly colleague, Bonnie Craven. She's just coming in. And our special guests tonight are Karen Bales, an activist with the National Education Union. Thank you for returning to the show, Karen. And Dr. Joe Vipon, the co-founder of Masks for Canada and president of the Canadian Association of Physicians for the Environment, over all the way from Calgary for COP26, but has very kindly given us some of his time to talk with us tonight. Thank you very much for joining us, everyone. I trust I find you all well. I hope so.
As well as can be expected.
Yeah.
Well as we get under the circumstances, aren't we? As ever, we tend to start these shows with a bit of a catch up on all things Safe Ed and Hive orientated. It's been a little while. Things haven't been good, most prominently, I suppose. And of course, we have to address this is the fact that we've now passed the 100 deaths mark in the UK amongst children due to COVID-19. This has not been made much of in our mainstream press. Frankly, it's criminal negligence, in my opinion, that they've not been covering it, that we've reached this point. And of course, this underlies much of our show tonight. Sarah and Nikki, would either of you like to start by addressing this horrific milestone?
Nikki, do you want to?
Yes, I mean, we heard today that it's actually now 103, which is another jump. I'm not an expert, but it does seem to have jumped quite quickly since the schools have been back. I don't know whether Sarah would agree with that. But as the Hive, we just felt there was a need for people to sort of do something because, as you say, it's not in the press. So we've been running Hive vigils on Thursdays at 8, which is just really to light a candle for 2 minutes, really just to I don't know, to acknowledge what's happening because it's not being acknowledged. And I think people needed something, just to do something really, because it's horrific and it's not being talked about. And, you know, they're not statistics, they're children. So we've been sort of focusing on that, and that's going to become a regular weekly thing now.
Yeah. So we decided that where there had been a clap for carers, that we would just post a virtual vigil for those who want to participate. So on Twitter, on Facebook, on whatever social media, just place a candle or a gif of a candle or whatever you can. Just
or a picture, anything,
Yeah, anything. People just felt there was a need to do something like that. So every Thursday at 8, we've continued this now for a couple of weeks, and we'll continue going, and hopefully that number will not rise. But while we're remembering those that unfortunately are not living with COVID, the under 18s, you know, because we're focusing on the school situation for Safe Ed, we are focusing on the under 18s. However, that doesn't mean that we forget the many others who are not under 18, who aren't able to live with COVID. We're just holding this vigil for the under 18s. And yeah, it's terribly sad, but it also makes us then remember that there's 1,000+ hospitalised children each month at the moment. This is living with COVID. There's 53,000 long COVID kids. 11,000 of those have had symptoms for 12 months, longer than 12 months, sorry. And we don't know where that's going to end. And with the infection rates now in under 18 being so high, we know that that number of long COVID kids is going to increase. It's a novel virus whose full effects aren't yet understood. And we still are just in disbelief that this government has decided that they're going to purposely infect young children because they're in low risk groups. Well, it might be low risk from death because the numbers to them are not of any consequence. So, you know, the 103 families who've lost a child won't tell you that that's the case. However, yeah, we're still here. We're still remembering that there are people out there being infected unnecessarily, and we're still trying to stop this.
And it's been the one thing I think that's got us all is just the complete lack of media attention to any of this. You know, it's just shocking, and that's what we're trying to break through, really, because these figures, you know, people don't know, and I think it's no wonder that they don't understand, because when you do tell people, they're quite shocked. Yeah. You know, and as you were saying earlier, it's the messaging. We need to get this information out there.
And while I'm here, I'll just quote some other figures related to the whole school thing. So 576 dead school staff. That was some figures we were able to get in January. We have no idea what those figures are now. We're still trying to get the information. 114 teachers with long COVID, and 8,000 plus COVID orphans is recorded at the minute. So they're figures that people shouldn't be forgetting, and they're not just numbers, they're people.
They're not. They are people. They are lives. But the fact that these numbers are not being made public, that more fuss is not being made of these figures. I mean, these are harrowing figures, and of course, the most harrowing aspect of all of this at the moment is discovering that perhaps this could all have been completely avoided if supposed scientific experts, people advising the government, perhaps were doing their jobs properly and were putting lives ahead of, well, profit and the economy. Seemingly, we've seen almost all mitigations removed from schools at this point now. We repeatedly hear that the government are listening to the science. However, with the publishing of the JCVI meeting minutes, something that is some 8 months overdue and apparently done on the sneak to coincide with COP26, so sneaked out while a big event is happening and the media are looking elsewhere. This committee of scientists, the ones the government is supposedly listening to, Joint Committee of Vaccination and Immunization, they have seemingly admitted that they downplayed the harm COVID presented to children in order to promote an agenda of herd immunity and boost immunity in the adult population by allowing our children to become infected. People who have heard of this committee might recall the news coverage recently saying they did not recommend immunization of 12 to 15-year-olds, something the government did overturn. Now, Karam, I know you've been, over the last several days, you've been writing an excoriating thread on Twitter. You seem to be adding to it all too frequently. What exactly is the influence of the JCVI for people who might not be familiar with this body, and just what has been exposed here? Could you take us through it, please?
Yes, so to begin with, it's worth bearing in mind that the remit of the JCVI that we were told was that they would only be looking at the individual the benefits of vaccination to the individual student and not at a population level. What we have discovered, however, is that lots of other things were discussed. So to begin with, one of the main things that we found. Oh, I think is my internet all right?
Yeah, you've still
I think you keep freezing a little bit.
Yeah, I've got a little red bar. Sorry about that.
Your audio is fine though.
Okay. So to start with, the first thing they needed to do was to calculate the harms of COVID and calculate the harms of the vaccine and balance up. That was kind of their role. What we found to begin with was they looked through the MHRA recommendations and all of the guidance that proved it, and all of the MHRA data was looked through, and it shows that the risks of things like myocarditis are very rare, and when it does occur, then it's very, very mild. So they had all of the data that the MHRA looked at, which says vaccines are safe. They then looked at the risks of COVID, and this is one of, I think this is the biggest issue, is that the evidence they looked at was mainly only things produced by Public Health England, their own data, and so the general gist that we got was that schools are not hubs of transmission. They're still playing that, but it still says, it constantly makes reference that infections in schools only reflect community transmission. It talks about the fact that and all of those studies that we've seen, which have been criticised throughout, they went through. So the first thing they did was they minimised the harms of COVID, to the point where at one point, one of the bits of data said that ICU admissions are around 1 per 500,000. But we've had well over 200 ICU admissions that we know of from COVID. So according to those figures, we would have needed 129 million children to have been infected to have the current levels of ICU that we know of. So the figures just don't add up when they're trying to calculate harm. They completely dismiss long COVID. They refer to it as several times. They refer to it as perceived long COVID.
Didn't they also, sorry to interject here, Karam, didn't they also in one of their points say that the vaccine may help reduce anxiety in children who are worried about long COVID. So basically, is it almost like a placebo that we might think about giving the children? It might be a benefit to give them the vaccine, not because it will help them in any way or lower their infection outcomes or whatever, but because it'll stop them being anxious. It was very patronizing in that way.
Yeah, it's, and in that, the next line after that is, it says it's difficult to attribute to biological effect of infection. So they're saying they're questioning long COVID as a whole regularly, making out, and there is another reference where it says the long COVID is just the same as other post-viral issues, and that there's no biological evidence behind a lot of long COVID. Whereas we particularly like things like, I know a lot of people don't, the neurological issues, we've now got increasing amount of brain scan data. We've got lots of studies have been coming out now looking into long COVID, and we are finding all sorts of neurological impacts of COVID, which are measurable as well. And they've completely dismissed that as well. So that is kind of the issue that we've found there, is that, but first of all, they discounted the impact of lots of issues with COVID. The same as PIMS as well, which is a rare condition that children get. Originally, they were likening it to Kawasaki syndrome at the start, but that's been completely dismissed as well. But then they go on to start discussing benefits which aren't on the individual. So they start going down a bit of a herd immunity route repeatedly. They start talking about natural infection, the benefits of natural infection, and then they go on to say that there would be benefits of allowing the virus to circulate in children to boost their immune system, and also to boost the immune system of adults. There's another bit where they suggest that children are unlikely to have a substantial impact on the next wave. We've seen how many infections there have been in schools. For instance, they estimated the attack rate would be 4%. So they estimated around 4% of children would be affected over a time period. Well, in reality, in hindsight, we can see 11% of all 10 to 14-year-olds have a confirmed positive infection over this time period. It just doesn't add up when they're looking at the evidence of harm. And this is the main concern, really, is they've minimized the impact of COVID massively. They're still making out that transmission isn't really occurring in schools. They've discounted long COVID. They've discounted PIMS. They've looked at a very narrow base of evidence, which is mainly stuff that's been generated by themselves as well, the Public Health England studies. And then after that, like, they start talking, there's a lot of talk about natural immunity, and a lot of the natural immunity stuff, like one of the models they looked at assumed that natural immunity would never wane. That was the figure they looked at. So they compared that to then looking at the possibility of vaccines waning. So all along, the language is very strange. There's other bits as well. There's one point where they say that protective measures in schools are the main cause of disruption in education, not COVID.
Firstly, that wasn't in their remit. Why were they even discussing the protective measures in schools? Their remit was supposed to be the benefits versus the detriment of a vaccine, nothing else. I don't understand why it was even discussed by them.
Exactly, and that's what they've done. So they said their remit was only look at the individual benefits, but then they go on about the benefits of, like, developing immunity in the population, of children spreading to adults as well. Which we're back to heard. It sounded very much like what we were being told in March 2020, but applying it just to the child population.
Yeah, it's very much like if you took that Great Barrington Declaration video that I've shared constantly, if you took that and you told me the minutes that are now out came from that, I believe you, because that would be how they would justify all of the things they were saying about teachers should be expected to just, you know, basically take one for the team and get infected. Why wouldn't they, to be able to keep educating the children? They said statements like that in that video. Therefore, those minutes that you've gone through, Karam, they just fit so perfectly. It's almost like they just took that model and discussed only in terms of herd and hybrid immunity strategies and nothing else. I don't understand.
There's one bit where actually the exact phrasing, I don't have it written down, but it turned around and said, we don't, now that the vulnerable are protected with vaccination, reducing infections isn't necessary anymore, which is the strapline of the Great Barrington Declaration. There and then. And when they do talk about deaths, they turn and say, but most of them had comorbidities as well. And they keep doing that as well. And they also seem to make out that they reckon that after winter, there's one bit where they make out that there won't be any waves after winter. And that by allowing all of the immunity to build up now before we hit winter, could prevent or protect the wave. Will protect us from the next wave.
And we've got to remember, these minutes have been released now, but they were written in May, June, July, that time, weren't they? So,
yeah.
And then we obviously had our Freedom Day, July, and let's all get out there, let's all mix, no more restrictions, clearly following that same pattern of, well, let's get everybody infected during the summer months, and we won't have the impact on the NHS in the winter months. Well, how did that work out? Because I don't see any massive...
We've got a virus here that is still poorly understood. We've got a prime minister who went on TV when it was spreading across Asia and Eastern Europe saying, well, maybe we should just let it pass through all of the population. And it looks like he surrounded himself by a bunch of scientists, not to advise him, but who just plainly agreed with him. And they've been supposedly advising him on what he should be doing, when in actual fact, it very much sounds like they've just backed him up, giving him his ludicrous idea of building up building up immunity. Where was the building up of immunity before we had the vaccine? People were catching it, people were dying, of course, people becoming very ill. Who was building up an immunity so that they never caught it again? People have caught this, even if they've been double vaccinated more than once. Natural immunity is incredibly low if it's developing at all. And even if it is, we don't know how long it's developing for. I'm going to come to Bonnie now. She's been listening attentively. I can see the expression she's putting on her face as she's listening to this. I can tell you're furious.
I am livid. I'm absolutely livid. I mean, so this report, the BMJ called it childism, which is a form of institutional child abuse fundamentally. Now, a number of parents decided that school was not a safe place for their kids to be. We suspected that our kids were being used as canaries in the mine shaft, if you like. They were being put out there as some sort of experiment to see what happened to them. And it would seem from those minutes that Karam has just explained that the deliberate intention was to use them as a vector of transmission to get this virus as well embedded into all of our communities as possible. In the meantime, the parents who took the difficult step to keep their children away from school, and those who were able to do it, let's not forget there are plenty of parents that had no choice in this matter because of job, because, you know, if they were frontline key workers or what have you, they had no choice but to send their children into school. But those parents who were able to make that choice to not send their children there have been persecuted. They've been prosecuted, they've been threatened with court actions, they've been threatened and received fines. Their children have been forced to be unrolled, which means actually the state is denying the right to education to our kids. But actually, more importantly than that, the state is ignoring the children's fundamental human right to life. They are putting our kids at risk. They're prosecuting parents for doing the right thing. It's absolutely abominable and it has to stop. I want to see full and frank apologies to every parent who's had to suffer with abuse, with threats from the local authority, with issues from their kids' school. I want to see every child who was forced to be deregistered offered an alternative provision of education that is safe. That is some online provision, or let's set up those Nightingale schools that they spoke about a year ago. Remember them? You know, there's so many things that they could have done to protect our kids and our communities. I'm speaking as one of those parents who was not going to send my child into a place that I knew would be dangerous for them and for me as a clinically extremely vulnerable person. I made that choice not to do that, and I was able to. My kids deserve the state offered education that every other kid gets, but I am never ever going to put my kids in way of harm, and there are thousands and thousands of us like it. I know that the homeschool support advisor in my local authority has said the number of parents that have gone into home education during this pandemic, they've never seen a rise anything like it. And that means all those kids, if it were not for COVID, would have been in school, and they've been denied a proper education, proper assessments. It's messing up their GCSEs, their A levels, their ability to do things. So in the light of all this, what does our new Minister for Education come out with today? Just after that report, Nadeem Zahawi has come out today and said we need to extend the school day. Why is that? Is that to extend the viral loads, increase the viral load on our kids? Is that going to address the teaching retention crisis that we have? Anyone who's, I used to be a teacher, anyone who's worked in a classroom knows that when that bell goes at the end of the day, the kids have had enough. They are exhausted, whether they're 5 years old or 18 years old. Learning's tough, learning's tiring, and a full day at school, to consider extending it at a time when kids and families are ill, it's a time of enormous mental health stress, all these things going on. The very last thing he should be looking at doing is extending the school day for kids, is extending the school day for the staff that are working there under enormous pressure. And by the way, they deserve a proper pay rise, which they're not going to get. They need to address all of these things, but the main thing is stop abusing our kids, please. Give them what they're entitled to.
Exactly what you just said, Bonnie. It's like he's got the inability to read the room. Right now is not the time to start any of those discussions. I think they're wrong anyway, but right now, make schools safe, make them safe, sustainable and fair to all. Yes, there are some clinically extremely vulnerable children who, being back in school, even if we put in mitigations right now, it still won't be enough to protect them. So they need to have remote access, remote online learning. But everybody else, and my school, I was run by my very nice principal today, and my best friend at the minute, so I'll be nice about it, and was told that the trust are putting in, they're recommending mask wearing again. Now, my boys have worn masks since September 2020, despite the fact that I had to fight for it, despite the fact that I had to go through a 3-stage complaints process that took till January to get the ability for anybody else to choose to wear a scientifically recognized mitigation. They're now phoning me and telling me, oh, aren't we good? We're bringing in masks, and we're recommending from tomorrow that everyone should wear masks. Still optional in the classroom, but we're going to strongly recommend. Well, I'm not going to look a gift horse in the mouth, as it were, but I'm not going to overly praise people for doing what they should have been doing since September 2020, going to remote virtual assemblies. They're keeping lunchtime just to year groups, that's 300 in the hall at one time, rather than, mixing year groups. And they're recommending masks. But it shouldn't be down to individual schools. That's where we're getting this head teacher, individual school trust lottery. This should be a direction from the Department for Education. It should have been a multi-layered, scientifically recognized mitigation strategy from the outset. Vaccines are not the silver bullet, and now it seems they're just heading for, children can be vaccinated. Well, only with one anyway. Yeah. It doesn't cover those children who are in year 7 who are mixing with everybody else who can have one dose and they're not yet as well.
Yeah.
Exactly. So it's unfair already. Again, we're saying we need it to be safe, sustainable and fair to all. That's not fair if everybody isn't given the same opportunity to and access to a vaccine should they want it. No. It's just everything about the whole system has been messed up.
And if I can just say, sorry, if
that guidance just needs to be ripped up and started again.
If anybody's doubting that these stories about what the schools are actually doing, my 11-and-a-half-year-old son, who can't be vaccinated, even though he's in the same class, same building, same virus with 12-year-old friends, has decided that because I'm vulnerable, he's not going to attend school. And I was actually told in a recorded Zoom meeting by the education welfare officer, he had to come in or I would be fined. And she said, my suggestion is that you off-roll. That's not right. That's no, they're not allowed to do that. But she said it, and I said, yes. I said, you're telling me that the only way I cannot be fined is to off-roll. And she said, yes. So this is happening.
In light of what these minutes have exposed, now they finally come out, what's coming through my head, what occurred to me, what I noted down a moment ago was, obviously, I know you guys at Safe Ed and the Hive work with the Good Law Project. How many parents who have been prosecuted or threatened with prosecuted in light of this evidence that's come up now realistically have some sort of legal recourse to take their local authorities or even the government to court over this?
The problem with the guidance, and this is what we've been told repeatedly by the Good Law Project, by lots of other people, and we've spoken to Mark McDonald on this.
Sure.
And Mark is waiting for a test case. He's waiting for a test case to be able to level it up and take it to the Court of Appeal. However, he's winning. When he goes to the magistrates' courts, he's winning and parents aren't getting fined and it's being dismissed. What he actually wants is it not to be dismissed at one stage so he can take it further. That's not great for the parents, but there are some parents who are willing to be the test cases. But every law firm that we had spoken to, we've spoken to a lot before we got the Good Law Project involved, said the problem is the guidance. The guidance clearly states within it that the schools must adhere to all health and safety legislation. Now, in saying that, whenever you say, but the schools aren't doing this, school risk assessment is allowing assemblies, the school risk assessment is increasing risk, is not lowering risk to the lowest practicable level, you can't go after the DFE first, because the DFE's defence is not our problem. We clearly state adhere to all health and safety legislation, despite the fact that then the rest of the document tells them to allow bubbles of hundreds, to allow to not allow a remote provision unless someone is infected. That's the only time you can have remote provision at the minute, is if you are infected. When my youngest son was infected and I kept my eldest son home, they would not allow him access to the remote provision because he wasn't positive. And I said, but he's staying home for the 10 days. That we're sticking to that. I don't care what the government says. That's what we're sticking to. He was not allowed access. So the rest of the guidance goes on and makes a mockery of that statement, adhere to health and safety legislation. But it's very well thought out from the whole slopey shoulders. Nothing sticks to them, because at the first instance of any legal action, a parent is going to have to take an individual head teacher or an individual school trust to court first. They're going to have to go through a civil action if they want to challenge the risk assessments and take that individual school to court. Now, parents don't want this. None of us want this. We don't want to be pitted teachers against parents. A lot of teachers are doing their best in very difficult circumstances. I acknowledge there are some, and we've got evidence, reams of evidence, who really are just not listening, are not paying attention, are not understanding what their actions are doing. But the majority of school staff, they're at risk themselves and they know this and they're doing what they can. So no parent wants to enter into any legal action against a school which essentially they want their child to go back to. So you don't want to set up this adversarial, horrible situation. You don't want to add to it. So we need the DFE guidance to be ripped up and started again. We need someone with a proper scientifically recognized mitigation strategy to come out and say, this is what education should have looked like in a pandemic to make it safe, sustainable and fair to all. And until that happens, we're going to keep having these head teacher lotteries, local authority lotteries. You know, in Wigan, I'll talk on from Lisa's point of view. Well, Lisa, she's got 20,000 followers at the moment. She's very pleased about that today.
Yes, indeed, yeah.
In the same town where she is being told that her dyslexic primary daughter cannot have access to any of the remote learning, and she's being threatened with fines, prosecution, ankle tags, everything else. In the same town, Wigan, a small town in the northwest, a school down the road has said to the parents, I can't guarantee I can keep your child infection free. Tell me what you need from me. Why are we at this kind of at the whim of whether you get a head teacher who gets it or whether you get a head teacher who is basically believing
Abdication of responsibility from the top. Fundamentally, the education, local educational authorities, the academic trusts, the government, local, national, they don't want to know. They are leaving it up to the head teachers to interpret the rules as they see fit. And as you say, it's a lottery as to what sort of a head teacher you then get. I do wonder. Sorry, Bon, I just wonder whether you know, with the as far as legal action goes, I mean, we touched when we were talking about the JCVI itself earlier on as to whether as you know, operating beyond the remit they were given. I wonder if they've left they themselves as a committee have left themselves open to any legal recourse. But I dare say it'll be interesting to see if anybody who watches this has got some comment to make on that. Bonnie, yes, sorry,
Damon. Yeah, I was just going to say, I was hoping to send my kids back to school last September. I hoped after the summer holidays it would be safe for them to come back. It was never my intention for them to be out of school permanently. I wanted them to carry on, especially since one of mine's just in the first year of his GCSEs, and I wanted them to go back. I really did. But what blew my mind was at the same time, they decided to disband masks, they dropped the bubbles, they stopped any form of restrictions. I mean, there were never the proper provisions put in place, such as the perspex screens around the students like they've had in other countries in the global south. But I couldn't understand why they dropped it, and I was honestly baffled. But when that report came out accusing them of childism, it just looks ever so sinister to me. If their intention was to do anything other than deliberately infect our kids and infect our communities, put our children, who are the most precious things in any parent's life, put them at risk, in line of risk, then they couldn't have made a worse choice, really. It seems like it's deliberate. It seems very sinister. And as much as individual parents are fed up with schools not providing risk assessments when they ask for them, with local authorities hounding them, threatening them with fines and prosecution and even jail terms and things like that, as much as all of that's gone on, actually, I think that the root of this problem lays at the door of number 10. We have a prime minister who said, let the bodies pile high. And it seems like he wants our kids on the top of the pyre. And I'm really cross about it. And it's about time parents in this country started making a stand for the rights of their children and their families. Because I'm fed up with it. Kids need a trade union. Let's get one started.
We're trying, yeah.
We're trying.
I just wanted to say, if it's okay, just to butt in, I actually wanted to say thank you to Karen, because, you know, without people like him, you know, would we have found this out? You know, it's wrong that this kind of stuff is allowed to be snuck out. I've only seen 2 newspaper articles since this came to that on Twitter. Would they have bothered? And I think that certainly from the highest point of view and on a personal point of view, you know, we're seeing that the America is on the brink of offering the Pfizer to 5 to 11s. When you read the JCVI minutes, do we stand a chance of even getting that here? You know, and it's just frightening, really, that they do have that. And if that's their thinking, I have little hope that actually we will get that over here. And just thank you to Karen for bringing it to people's attention, because I think it would have gone unnoticed.
Here for that. He's done a sterling amount of work on it and reinterpreting what is some quite wordy, quite dry documentation, but it's damning as well. It really does expose this scientific advisory body as not actually following science, but following ideology.
Flawed ideology.
Yeah. Karam, I left you out of the conversation for a little while here, Sue, but quite undeservedly, given that the entire show is pretty much built around what you've pulled apart. But Nadeem Zahawi and his comments. So there's something like nearly 250,000 children off school because of COVID-related illness the week before half term. Now he wants to extend the school day to teachers such as yourself. Smacks of working you into the ground, similar in a way to how they've decimated the health service, really. You were telling me about staffing before we came on air. What do you feel about having a longer working day, sir?
Well, it's quite interesting to see what he's actually said. So he was saying that schools need to extend to a 6.5 hour day. That's for standard length school day. But what he's saying is that some schools aren't up to that 6.5 hours. Now, he should look into why. So what he's saying is that all schools should be at this amount. Well, most of the schools that aren't having a 6.5 hours per day, that's over the week. And the reason why they're doing that is it's mainly primary schools, and it's primary schools which don't have adequate funding to open for 5 full days. And so they have half days on Fridays, so they can send send support staff home, and they can move all of their free periods, all of the PPA time to that Friday afternoon to get it done. So the only reason schools aren't up to that 6.5 hours, which he's now demanding, is the consequence of 10 years of austerity and education cuts and a 9% reduction in per pupil funding. So what he's moaning about is the consequence of the policies he's voted for 10 years.
Yeah.
And
Has
so
no suggestions of how to fix those.
yeah, so it's quite mad. Going back to roots to fight this, I wonder. I've been saying for ages that I reckon that the main way we'll get justice is retrospectively through compensation. Because actually, if you look at the JCVI minutes, on the 29th of June, they'd commissioned modelling from Public Health England and Warwick, and they would produce 2 different models that both predicted that vaccination caused a substantial reduction in hospitalisation of children and a large reduction in infections across the population. They dismissed it completely, and their argument for it was that all of this modelling was based on last winter during the alpha wave, and that was before once the adults have been vaccinated, we won't get infections in school because schools reflect community infection. So because the adults there'll be no adults bringing infections to children, and therefore children aren't going to bring infections into school, so we don't need to worry. They've got it the wrong way around. We can look at the data. Just look at the ONS data on infections broken down by age groups. Look at those secondary school kids. Look, the rate of infection in them is huge compared to everybody else. They've got to be driving infection. Like there's been loads of studies coming out around the world now. The whole massive principle at start of the pandemic that children were less infectious has been blown out the water long ago.
I don't even know where that came from. Do you remember where that came from? The whole suggestion that children, first of all, can't contract, and then, well, they can contract, but they don't get sick, and then, well, they can contract, but they don't transmit. Oh, well, they can transmit, but they're not as transmissible vectors.
Oh,
wasn't it something to do with Jenny Harries in buses or something? Wasn't it around that time?
And it's a really good point. So the first we was getting data out of other parts of the world, and so we knew that children were going to have like lower mortality rates, which is true. The point is that it's still a high enough rate to be worried about, isn't it? So of course less children are going to die than elderly people. But the first study to come out that the UK based this on was published at the very start of April, about a week after we went into lockdown. And that study was produced by Russell Viner, who at the time was the president of Royal College of Paediatric Healthcare. He was one of the presenters of evidence at the JCVI, or at least one of their meetings where they discussed the risk to children. And his study was based on, he went through their databases of studies on different illnesses as well. So he looked at 60 studies, I think it was around 60 studies. Most of those studies were not COVID. He looked at influenza, he looked at SARS, he looked at loads of other studies. He then got some very preliminary data out of some Asian countries where they'd had COVID cases already. And so he did what is called a systematic review. And the systematic review found that, and it even says, unlike influenza, which children are major vectors of transmission for, in COVID it's different. And it even says that when we go to the JCVI minutes, like we don't say know who said what, but there is even a phrase there where COVID in children is different. And it's literally that's the phrase. COVID in children is different.
Different in that it doesn't kill as many of them as it kills adults, but it's not different in terms of they are infected and they can contract, they can transmit. I keep saying 3 things that if this government with its public health messaging could just get these 3 things to be understood by everyone in society, things would change. COVID is airborne. Everyone, no matter what age, sex, gender, whatever you are, can contract and can transmit. And nobody can yet guarantee how your body will react to infection. Nobody can guarantee that you tomorrow, if you got it, Bonnie, could be fine, and I could end up in ICU. Nobody can tell you that. It's just, that's the unpredictability at the minute. Healthcare workers are saying the same thing. The fact that they're seeing people who, on paper, should be able to deal with this really well, healthy, fit, young, you know, and they're not, and they're perplexed by it. So if those 3 things were understood by society, people would start wearing masks, people would start taking this seriously. But it's the public health messaging again, and the fact that they focused on a virus study just says it all to me. You know, he still was along with Harris saying children can't wear masks.
It's finding evidence to fit their own narratives and their own beliefs. COVID is airborne, flu is airborne. Children are the same species as adults. We all have noses, we all breathe things in exactly the same way, and that includes these airborne viruses, and they will infect people in the same way. They are not necessarily going to become ill in the same way, but there's no, because we understand COVID so poorly, we still don't understand, as you quite rightly said, Sarah, quite exactly who is going to be particularly ill and who maybe isn't. There's no, doesn't seem to be any rhyme or reason that we can yet get a handle on. But it's just, I'm at a loss for words. I really am. Bonnie, I know
that's a rarity.
Save me. I know. It's not like me. It's temper. It's anger. It's anger. When I get angry, I get frustrated. It's just so ludicrous. Why on earth is this being allowed to happen?
I mean,
I said to people that I didn't think that Karam's work would make it to the press, and I was wrong.
No, they're helping them out.
No, the 2 articles I've seen, one of them, which won't be named, actually managed to somehow turn it into attack on independent Sage, and the second one that Sarah and I have both just read made it sound like it was all perfectly normal, and this has all been blown out of proportion.
The other thing that we don't know as well, of course, Damo, just to add to your anger, justifiable anger there, is we don't know what the impact of catching this virus will be on the children in 5-10 years time. Does it set up other complications later on in their life? We don't. The answer is we have no idea. We've all gone into this blind, and the experts that are pretending otherwise really need to go back and take a look at their Hippocratic oaths or whatever it is that they're using to base their proclamations on, because they've got no evidence. But what we do have evidence of is that within 2 weeks, every time there is a school holiday, infection rates amongst children and amongst the wider population drops substantially. So what we do know is that if we keep the bulk, the vast majority of children away from school and provide them with learning in some other way, we can keep the infections down. You know, the vaccine's been a massive boost for the general public's health, but as was said earlier, the efficacy of how long that lasts is it would seem that they only last about 6 months or maybe less. The main way that we can drive this virus down is to keep children educated, but keep them educated otherwise, make schools as safe as possible for the kids who do have to go in, and put some provisions in. Let's make wearing masks mandatory again. It really isn't a massive pain in somebody's life to put a mask on while they're out and about. I prefer that to a ventilator down my throat every single day. Let's get them back on. Let's ask for employers to have people working from home where it's possible for them to do so. And in that, I include school staff, because they shouldn't be forced into an unsafe workplace any more than our kids should be forced into an unsafe workplace. Let's get things sorted. Let's get behind our education unions and let's make our demands. We're on the same side as the teachers, as parents. Yeah. We need to use our collective power and ask some serious questions at the people sat at the top of our government, in my opinion.
Yeah, can I just point out something that people who argue against me constantly when I ask for mitigations, because apparently out there in the wider society of those who don't understand why we're asking for mitigations, is Mitigation means I want schools closed. It's the exact opposite. I'm the
Mhm.
one saying our schools can remain open if we use the best practice from around the world, if we listen to the scientific advice, we know what infection control measures are needed. Yes, it means that education and the way it's delivered will have to adapt and change, probably for 2 academic years, but it doesn't mean that it has to stop. It doesn't mean that it's all or nothing. Stop polarizing the debate. But a lot of them say to me, you do realize that if schools close, all those vulnerable children, all those children who are suffering terribly at home, or disadvantaged backgrounds, or abused children, will be at home at risk. And I'm going to say this on air, I am one of those children. School to me was a respite. School to me, until a teacher at the age of 14 knew about the abuse. School to me was where I got away from everything. I didn't like summer holidays. I didn't like weekends. I wanted to be in school. Now you tell me what infecting me at school with an illness, which I may just get over very quickly, or I may end up with long COVID. You tell me how that would have affected me, how you would have made that choice to take away my respite because you've infected me with something that was completely avoidable. So all of those people who say to me, oh, you want schools closed? No, I do not want them closed. I want them to be there. I want them to be there, safe, sustainable, and fair to all. And I want every child, whether they're a child from a disadvantaged or a neglectful or an abusive background, to be able to access it. And what I don't want is them to be unnecessarily infected in doing so. So I'm really getting annoyed by people, particularly on Twitter, accusing me of wanting schools closed and then telling me that I'm going to damage all of those vulnerable, disadvantaged and abused children in society. I'm well aware of who they are and what they're going through. And I do not want that. And weaponizing neglected, disadvantaged and abused children really is winding you up at the minute. So I just had to get that.
No, I
Yeah,
totally get that, Sarah. The simple fact of the matter is, this program, Your Safe Ed for All, from day one, we have always said, we have never deviated from the point that we want schools to stay open. We want our children to get an education. Of course we want that. We want the best for them in life, but that cannot happen when we have a government being advised by a body which apparently is saying long COVID is all in their heads, apparently, is denying that kids spread it, is denying that schools are the single biggest sources of transmission, simply because there's an awful lot of bodies in a very small space and they're all spreading it amongst themselves. Schools are the most densely populated buildings in our society. There are literally hundreds of people in them of all ages at all times. Why is this so difficult for people to get their heads around? Mainly because people are telling them, oh, no, that's not true. That's not otherwise. They've taken away the mitigations. The spreading is going on more and more in schools. Vaccine efficacy, as Bonnie rightly said a moment ago, is waning. This is why we've got a booster rollout for the most vulnerable in society. And by continuing to say kids do not spread it, these vulnerable people in need of boosters, and the booster rollout is not going particularly quickly, and is not being taken up particularly brilliantly from what I've been reading. It's little wonder we're seeing cases rise, hospitalizations rise, and deaths rise. Something like 293 deaths today, and 3 of those, I believe, Sarah, were children.
Yeah.
God.
It's come on, people. I mean, I'm pleading with you here. You're being taken for fools, and the government is being advised by people who are advising them of what they want to be advised on. You know, they're taking the advice they want to hear, not the advice they need to be told.
I think all of us realise that the plan B, you know, that was being touted about, that everyone's calling for plan B to be enacted now. We all know that that's not going to happen until COP26 is over.
No.
And does that not annoy everybody in the same way that India wasn't put on the red list because there was supposed to be a trade delegation, in the same way that things have been delayed? They're delayed not with the interests of the British public at heart. They're delayed with the interests of a government who wants to see themselves on the world stage. You know, the same reason why the last large international event ended up with a surge in your area, Damien, was because they didn't stop that happening. They allowed unmitigated mixing of households and people from all over the country and all over the world to mix in the one place. Not to mention the things that they don't help with, the security details who are all being bussed and moved from other places in the country to take care of those delegates that are at COP26 or at that last event. It's just madness. And we're being sacrificed. Teachers are being sacrificed, teachers' families. You know, how many teachers have a pregnant partner at home?
Yeah,
they're putting them at risk. How many children have pregnant parents, you know, live in households? The high risk groups, they're not, when people say underlying conditions, pregnancy is one of those underlying conditions, by the way. So is that okay if they only had an underlying condition? It's just madness. I can't stand the ableism, I can't stand the childism, I can't stand this kind of weaponizing of schools open versus closed.
And how many children are going to suffer because they felt it was their fault that they brought the virus home?
Exactly.
Really?
That's
You
a
know,
psychological blow, especially if an elderly relative or something like that gets seriously ill or worse with it. What do we need? I mean, I'm going to ask the obvious question. What needs to happen now? Because we're seemingly heading towards a mainly school-driven, massive winter health crisis. Cases have been steadily rising for weeks, as we've said. It's not quite winter yet, but we're seeing over 1,000 deaths per week now. So that's 52,000 fatalities a year. Apparently, we were going to enact some further mitigations once it crossed 50,000. That's not happened. Oh, what a surprise. Boris Johnson hasn't kept to his word. But we've got understaffed, underfunded hospitals as well as schools, which have also faced years of bed reductions. We're seeing people dying in the backs of ambulances, waiting up to 8 hours to be offloaded, or never seeing an ambulance arrive. Hospitals are on their knees, and we've got a government determined to not return to lockdowns or mitigations. And the public reaction seems to be mainly indifference because our media is not covering this properly. What can we do to get this message out more when we're screaming into a void, it seems?
I don't know. Karam, what would your wish list be right now for schools? What would the ideal, you know, top 5, whatever wish list for schools right now?
To start with, bring back masks, put masks into the classroom, and specify like they have in other countries that we have like N95s, FFP2s, isn't it? Get those like masks. You can bring masks into the classroom, mandate them in the classroom. That will make a difference right from the start. The next thing is contact tracing. We need to bring back contact tracing in schools. I thought that was insanity taken away, and we've seen the consequence of it last term, massive amounts. Because what happened was we got a couple of more weeks of quietness, and then we ended up with almost as, but we ended up with as many. Look, we ended up with 246,000 children off, and they were off rather than being off isolating, being a contact. They were all off because they were ill, and then the Royal College of Paediatricians is saying, "Oh, scrap testing." And like, but that doesn't matter because like all the kids in my school, virtually none of them are off because they've tested positive. They're off because they got sick and then they got tested and found out they were positive. Children are being ill. That would be my number 2. Number 3, we need to update our symptoms. We still only have 3 symptoms identified, and we need to get the proper Delta symptoms recognized, because although you can just say, oh, you've got those symptoms to get the test, when it comes to schools, it means children are being sent in and schools aren't sending home children who've got it. And so I know people who've had somebody get sent into their class, child's got obvious Delta symptoms, they've gone to send the child home, child got given a paracetamol, put back in the room. 5 days later, that member of staff in that school is sick as well. So that would be my next one. And then long term, we need to think ventilation, don't we? We need to think ventilation if we're gonna we're gonna have a long term effort, because at the end of the day, we don't know what variants down the road. We don't know if we're going to get another pandemic virus. We've gone 100 years without a full blown pandemic like this, but it's almost random event, isn't it? So we don't know if when we get another one pop out, or if we get a vaccine evasive variant. So we need the pandemic proof. Get that ventilation in. We've also, whilst all COP's been going on, there's been a lot on air pollution. The impact of air pollution on children's health. They talk about the child who died of asthma who had pollution as a cause of death on her death certificate. Which students are getting hit by most by air pollution? It's the inner city ones in disadvantaged areas as well. So they're being hit by pollution, and also, as the JCVI recognise, disadvantaged Black and Asian students are most likely to have worse health outcomes from COVID infections. And then they went, you know what, we're not going to vaccinate. And you think, well, that's why some people are saying this reeks of eugenics.
Yeah, it's not wrong. On that point, many thanks for all of your contributions tonight. We're at the end of our time. Some viewers may have noticed that we lost Dr. Joe Vipond earlier on. Unfortunately, he had some technical issues and he had to go. We'll hope to get him on a future show. Thank you very much, Karen Bales, for all your work and everything you've done, and your lending to the discussion here tonight. Thank you very much to Sarah and Nikki for everything you're doing. Thank you very much to my Socialist Telly colleague Bonnie for jumping on and adding her contribution. I know this is a very, very important subject to her heart as well. And we're delighted to be running these shows once more, and we shall